Welcome to Therapy Explained. My name is Deniss Planner. I'm a licensed therapist, and today we're going to be talking about CPTSD, particularly within the context of inner child healing and what it is like to experience it as a woman, particularly as a woman of color. So in this channel, what we talk a lot about is inner child healing, intergenerational trauma, cultural factors. And as we're having these conversations about how to heal your inner child, how you can heal your relationship with your parents or find a relationship with your family that feels safe and comfortable for you, I think it's also important for us to talk about what CPTSD is. If you're familiar with mental health diagnoses, then you've probably already heard of CPTSD. But for those of us who may not have, let's talk about what it is. CPTSD stands for Complex Post-Traumatic Stress Disorder. It is an adjustment or addition to what we have already diagnosed and worked with, which is post-traumatic stress disorder. So let's take another step back and talk about what post-traumatic stress disorder or PTSD is. If you're interested in getting more of the nitty-gritty specific diagnostic criteria for it, I will leave a link for it down below so you can read more about it, but I'm just going to give you the general gist. To be diagnosed with PTSD, you need to have experienced a life-threatening situation or a perceived life-threatening situation. So maybe you've been in a car accident, you've experienced abuse or physical threat to you, but it could also be psychological. Someone may have threatened you with something even if they haven't actually done it, or you may have witnessed someone else go through something like that. So witnessed maybe like a really bad car accident, or in the case of a lot of the conversations that we have here is witnessed domestic violence or witnessed violence from police brutality. Things like that can cause PTSD. This severe threat of your own safety will hit your nervous system, and you'll end up experiencing things like rumination. So kind of thinking about the event a lot, but trying to avoid it. So you'll have those invasive memories of the event, but then you'll also behaviorally try not to think about it, try not to talk about it. You may also experience a lot of nightmares, and in more severe occasions, even have flashbacks, so feeling like you are reliving that experience. PTSD was a diagnosis that originally came from or was first identified in veterans, so people who came back from the war or from wars and were experiencing all of these symptoms in connection to the violence that they experienced while they were abroad. However, this was then over time also identified in people who experienced other traumatic situations. As we continue to grow, as the mental health field continues to grow and learn and gather data, we then also start to expand on this. So CPTSD, complex PTSD, is just that. We're expanding on what our understanding is of someone's experience of a very traumatic situation. So what CPTSD allows us to do is to look at what happens if a person hasn't just experienced one incident that was traumatic, right? Like just one car accident or one time you saw this. What happens if you grow up in a home that is neglectful, right? A parent that wasn't there for you, or extreme poverty, or if you experienced abuse, psychological or other types from your parents or grandparents. And in the context of what it is like to be a person of color, what happens if you're constantly subjective to violence from other systems or microaggressions, racism, misogyny? What does that do to your mental health? What does that do to your sense of safety in the world and how you view yourself as a person? And what I really want to hone in on, again, for the purposes of our conversation, is because we talk a lot about our parent wounds and our relationship to our parents and family issues. Again, it's trying to recognize what happens if you are a parentified child. Again, if you grew up in a neglectful or abusive home, what does that do to your mental health and your sense of self? What we discover is that the result is a lack of trust in the world, a lack of trust in others, lower self-esteem, just in general not feeling safe in the world. The 6 core symptoms of CPTSD. Number 1, emotional dysregulation. So because you've experienced neglect or abuse in some way, then it's very possible that you were also not taught what to do with those emotions. Couple that with consistent exposure to the situation and an extreme lack of sense of safety in the world, what's going to happen is that most of the time you'll go one of two ways. Either you will experience these feelings like as a wave. Something goes wrong and you just feel like everything is going wrong. It's just so overwhelming. These emotions that you're having feel so big that it's so hard for you to ground yourself, to think critically and figure out how to respond instead of to react. Or you may go the opposite direction, which is completely dissociate from these emotions. So something scary, something hurtful is happening, and immediately you will disconnect from what's happening in order to protect yourself. This makes it hard for you to relate to other people or to really experience. And this is also where we will sometimes experience not remembering certain moments or not having too many memories of our childhood. Number 2, negative self-image. So essentially, lower self-esteem. You might think of yourself pretty negatively and be highly critical of yourself. This is where we experience a lot of pressure to succeed. This is where sometimes we become kind of an overachiever and want to do a lot and do it really well. What we also tend to see, especially when we're talking about childhood trauma, is because we weren't able to get positive reinforcement, a sense of safety or love from our home, we may sometimes find that at school. So because we're doing really good in class and we're getting really good grades and we're part of clubs or sports, then that kind of gives us our sense of meaning, right? Or accomplishment. So because that's the only place that we're getting it from, it becomes that much more important. And then as we grow up, instead of school, it becomes work. So then we become an overachiever at work and want to do well and want to get praised because we're not used to getting that from our personal relationships. So what this may look like, again, is being highly critical, really having high standards for yourself, but this can also turn to really negative self-talk, being really cruel with yourself, to calling yourself dumb or useless. This might also look like a lot of anxiety and anxious attachment in relationships, where you might feel like you're not worthy of people's time, of people's affection, and are constantly afraid of people leaving you. So this kind of negative self-view is a result of a consistent exposure to traumatic situations. Number 3, interpersonal problems. The way that I like to look at this is through an attachment lens. As you may already know, if you've been around here for a long time, is I like to look at relationships through an attachment lens because I think it provides us with a really good vocabulary and a really good perspective to view our relationships through. If you've experienced a lot of trauma growing up, what is going to happen is that you're not going to trust the world. And if you don't trust the world, most of the time will go one of two ways. I have a whole video on attachment styles, and there really are 2 general types, secure and insecure. And then under the insecure, we have 3 different subtypes, and I have a video on it. Feel free to check it out if you want that. But today what I really want to focus on is the more typical ones, the more common ones that we see, which is anxious or avoidant. So if we're already saying we don't trust the world, part of that response is either going to be, I don't trust the world, and so I'm going to constantly search for that approval. I am going to constantly work to be enough so that people don't leave me, right? Because I am not, again, that lack of self-worth, right? That lower self-esteem tells me I'm not worth love. I am not worth that respect or people staying intrinsically. Like it's not just because I'm alive that I deserve that. I have to work for it. Otherwise people will leave. So we will experience a lot of anxiety in relationships. Or the opposite, because we can't trust people to stay and because they're going to leave, why bother? So we will become avoidant and not want to be vulnerable around people, not count on people. And this doesn't necessarily mean that you're like implicitly or even aware that you're thinking, I can't trust people. That just might be like an underlying belief of like, people are going to leave. People are not really that reliable. Why would I give someone that kind of power over me? If you ever think of that, like power, you're probably trying to protect yourself. And again, we're not going to allow that intimate connection to happen. And in both of these insecure attachments, we are having a hard time really connecting securely to someone. We cannot trust other people to really stick around. So that's either going to be why we're working so hard or not working at all, or constantly testing to see if they're going to stick around. So interpersonal relationships can be very difficult. And if we also think about having feelings like being overwhelmed by our emotions, we're going to be reactive in our relationships, and that will cause people to leave. And then sometimes we end up stuck in that cycle of I'm being very reactive. I'm not trusting the world. I may be pushing people away, and then people will leave, and then we say, see, I cannot trust the world. People cannot be trusted. Number 4, loss of systems of meaning. As people of color, if you're Latina, Black, Asian, or Indigenous, we tend to kind of also grow up with a faith. Whether or not you're identifying with it now, faith tends to be a really big piece of our culture and our identity. And if you experience trauma, especially at a younger age, but even as a grown-up, even as an adult, something extremely traumatic to you happens, consistently happens, right? Which is what gives us CPTSD. You'll probably either end up completely doing away with your faith and your religion, or really reconsidering it, questioning it, feeling disconnected from it. What we see in these moments is people may have also experienced trauma directly connected to their faith. And so that's another kind of layer to processing some of this trauma that you may be experiencing. But you end up having a loss of faith, a loss of connection, or starting to question it. And that itself can cause even more anxiety. So if this is happening for you, this is also a really good reason to seek that support so that someone can guide you through safely asking the questions that you need to ask yourself, and either reconnect with your faith in a way that feels safe to you, or give yourself permission to let it go and redefine what faith may mean for you. Number 5, attention issues. This is something that I actually like to provide psychoeducation on to my clients a lot of the time, because we tend to use things like ADHD as an explanation for why you may have a hard time paying attention to things. But we don't talk too much about how trauma can make it hard for you to pay attention, to feel restless. If your brain doesn't feel safe, right? Again, if we're talking about CPTSD, a loss of faith in the world, feeling like it is unsafe, a loss of faith in yourself to be able to keep yourself safe, your nervous system is always going to be turned on. You're going to be hypervigilant. And if your nervous system, your brain is focused on, am I safe? It's not going to be paying attention to math or English or what someone might be telling you about their feelings or their experience. You may have memory loss. You may forget things. Be forgetful because your nervous system isn't fully present. So you might experience some of that loss of attention or difficulty paying attention to things. Along with that, we might also see that dissociation that I talked about earlier. So either you're going to be flooded by the emotions, remember, or you're going to dissociate. And because you're dissociating, right, if you're having that kind of disconnection moment, then you're not going to be paying attention to what's happening. If you're having a moment that is triggering, which could be a moment of high stress or high anxiety. So if you are working at a company or at your job, it's very demanding and you feel stressed, or in a relationship you feel really stressed, you're going to disconnect and then not create those memories. So we're going to see these things as well. You may also be meeting criteria for ADHD. That could also be something that you're experiencing, but not necessarily. So I like to kind of start with this explanation first, figure out if we can help your nervous system feel safer and more grounded. And then if you're still having the same or similar issues, then we can kind of look at ADHD. I am a therapist, but I am not your therapist. So take this with a grain of salt and really try to pay more attention to what is feeling good to you. But I do hope that this piece of information gives you something else or a different lens to look at this particular symptom that you may be having. Number 6, maladaptive coping. Maladaptive is bad, adaptation. So it's a way that we adapt to our world, find ways to cope that are not the healthiest. This includes things like self-harm or substance use or reactive, dangerous behaviors in order to cope or numb ourselves from what is happening, right? Again, if you're not feeling safe in the world, your nervous system is turned on all the time, you're probably not feeling safe or comfortable in your own body. So we will go to things to seek that release or seek that disconnection from our bodies. And we will see unfortunately, a lot of substance use issues when we're trying to deal with some traumatic situations. I really like to come from a non-judgmental lens when we're talking about maladaptive coping behaviors, drinking too much, gambling, or self-harm, and really look at the purpose of these behaviors, right? We're trying to help ourselves feel better, trying to help ourselves feel safe. And if we are trying to address those behaviors, then we want to find other ways to feel safe and other ways to feel good. And that does take time. So be patient with yourself if that is what's happening, or if someone that is close to you or that you love is dealing with these things. Just know that this is a part of that process, right? And what we want to do is not shame or judge, but instead guide and replace some of these behaviors. It is absolutely possible to heal. If any of these things resonated with you, if you're feeling like, holy smokes, I think I might have CPTSD, a lot of these things feel familiar to me, I highly encourage you to seek professional support. Work with a licensed mental health professional to help you navigate all these things. Because again, I am a therapist, but I'm not your therapist. I don't know what is going on in your world. I don't know other factors that may be playing a role in this. So if you seek out someone who can get to know you, your experience, and help you figure out what your unique needs are, that will help you heal what's happened. If you did find this video useful, or if you feel that you learned something, please give it a thumbs up and let me know down in the comments below if there are any other topics that you want me to cover. If you are a paid member or paid Patreon, be sure to check your email. I've already sent you these resources that I mentioned throughout the video. As always, before I let you go, let's take a grounding breath together. A deep breath in through our nose. And exhale through your mouth. Thanks for spending this time with me today. Until next time, take care.